and thank you for attending our vein webinar this evening. I'm Dr. Jennifer Sanford, a vascular surgeon at Columbia Surgical Associates. I'm going to go through a presentation I put together on lower extremity vein disease. Sorry, I'm trying to get it to advance here. Okay. All right, sorry about that. A little bit about myself. As I said, I'm Dr. Jennifer Sanford, and I joined Columbia Surgical Associates in August of 2018. I'm board certified in vascular surgery, general surgery, and surgical critical care. I received my education for my undergraduate and medical degrees from the University of Missouri, Kansas City, finishing my education in 2010. I then went into my series of residencies and fellowships, ultimately completing my vascular fellowship through St. Louis University in 2018. And then, as I said, I came and joined Columbia Surgical Associates. This is a picture of myself and my husband, Jason. I like to do other things besides vascular surgery, and this is when he took me skiing for my first time in Vail, Colorado. It was pretty good. I had a lot of fun doing that. We actually got to the top of the mountain there. Took me forever to get down since I like the greens and the blues, but I had a really good experience. Hopefully get to go back soon. It's another picture of my husband as we were doing some hiking in the mountains at a separate trip. And those are two dogs, Millie and Lila, our two Shiba Inu puppies, are just over a year old. So I wanted to talk about vein disease because I feel that this is quite a bit misunderstood. Some people may feel that they simply have some varicose veins, but there's really oftentimes a deeper underlying mechanical problem. I think back to my dad, who had issues with both of his shoulders for a long time. He was having challenging episodes where he almost couldn't even dress himself to a point because his shoulder pain was so severe and his movements were so restricted. When I talked to him about this at one point, he had noted that he was very actually afraid of what might be involved in the surgery to fix his shoulder pains and this lack of mobility he had. When we went and spoke with the shoulder surgeon, the orthopedist, he was able to explain to us how there was a very minimally invasive treatment option for my dad. When he underwent the surgery and had wonderful, complete, full range of motion with his shoulders again, he kept saying, "Gosh, why didn't I do this sooner?" And I find that to be true with a lot of my vein patients. Having suffered from some symptoms for so long and not really thought much about it, maybe I have a little swelling or a few varicose veins here and there. As things progress over time, it builds up and they may not realize exactly the extent of their symptoms. When they do undergo a surgical procedure, if indicated for their vein disease, they are always very thrilled with the outcomes. Their symptoms are relieved, their varicose veins are gone, and I hear nothing but gratitude. And that's a wonderful thing that I can share with people, helping them through a problem that they may not realize how involved it actually is. So to tell you about vein disease, this is a circulatory problem in the leg veins, in which those leg veins are not effectively moving or say pumping blood back up towards your heart due to these non-functioning valves within the veins. Normally, arteries will carry blood to things such as your lower extremities and toes, and the veins will move that blood back up to your heart. To have the blood flow in the proper location and direction, we normally, as shown in this diagram, have paired cups inside the veins that we call valves. When someone stands up or their leg is in more of a down position, whether you're sitting or standing. Really anything other than that leg being, say, flat on the couch or bed with you or more elevated, then gravity is pulling downward forces on those legs and blood vessels. As you can see in that diagram again, on the far left, we have normal intact valves in which where someone's leg goes down in a standing or seated position, let's say, those valves should come together to prevent the blood flow from simply going between the valves and running further down your leg. When those valves are not functioning properly, as you can see to the right of that diagram where there's varicose veins developing, that blood flow is not halted at the valves since they're non-functioning, and the blood is allowed to move further down the leg with gravity. This can cause a variety of symptoms, and if left untreated, these can actually develop into worse, more serious complications, which are some of the things I'd like to talk about today. And I'd like to stress, and we'll go over, that minimally invasive treatment options are available for vein disease. So to review some causes of vein disease, there are several. Having an opportunity or having a job in particular, or that kind of lack of activity in which you are standing for prolonged periods of time or sitting for prolonged periods of time. When your calf muscle is not actually effectively pumping and moving because you're not up and moving or walking or exercising, that allows that blood to simply pool at a more constant rate in your legs. It's not helping to move the blood out of your legs. With heavy lifting or increases in abdominal pressure, such as pregnancy, we see patients in these instances develop vein disease and varicose veins. And other causes are known to be associated with smoking, cancer, prior blood clots, where some of the clot that develops, even if most of it, say, dissolves with some medications, can cause scarring of those valves to where they are non-functioning. This can also be due to episodes of trauma to the legs and veins. I see it in obese patients and also patients with a strong family history of vein disease. Symptoms of the vein disease can also be variable. I have patients describe to me frequently that they're having some leg swelling or heaviness, especially that is worse as the day progresses, and achiness in their legs. Whereas in this picture here, most people just simply want to rub their legs to try to make them feel better with maybe massage and elevate them at the end of the day. Vein disease can also cause some muscle cramps, particularly complained about at night from different patients of mine. It can also lead to skin changes that we'll cover shortly that lead to dry, itchy skin. As mentioned, their different skin changes can develop with vein disease, and things that patients notice and physicians also notice on a physical exam. These include spider varicose veins, some larger varicose veins that are a little bit deeper under the skin level, Venostasis dermatitis, and Venostasis ulcers. I'd like to go through each of these individually here and show some pictorial examples to help people understand what may be happening with their legs. So first, with spider varicose veins, as you can see in this picture, there are very tiny veins that are bold, sometimes red, blue, or purple in color, and they're right at the top of the skin surface there. This is one of the exam findings that we see on patients on a physical exam, and it's due to having high pressure in that vein system in their lower extremities. Varicose veins, as you can see in this picture, are different. They're a little bit larger and they're a little bit deeper just below the skin surface there. One of the most common causes of developing these varicose veins and spider varicose veins is having evidence that these valves in the main veins are failing. You can see in the right side of this diagram here that, as it previously described, the normal course of blood flow in the veins is to bring that blood up to the heart. When those valves are non-functioning in what we call the superficial veins, it can lead to this blood flow reversal as described that we call venous reflux, and further pressure even up towards these skin level veins, and over time those dilate to such a degree that they're visible as in this picture, and we call those varicose veins. Here's an example of before and after picture of an actual Columbia Surgical Associates Surgical Center patient that we've treated, in which they've undergone the EVLT, which I'll explain here in a little bit, and stab microphobectomy of these varicose veins. Venostasis dermatitis is another physical exam finding. This is where you have a change in your skin, in which the area around or above your ankles and on your lower legs, sometimes extending up to your knees, has color changes that may be yellowish or tan, maybe brown, red. I've seen people in the office who have a deep maroon or purple discoloration all the way around their legs circumferentially, even from the ankles all the way to the knees, sometimes on both legs. What happens is there's a thickening change around this area to the skin. Patients will also see hair loss at these areas around the ankles and shins. There's again this evidence due to these skin changes of high pressure in the vein system, indicate a good chance that this patient has the underlying problem of venous reflux and those non-functioning valves. You can also see there's significant swelling that develops with vein disease. With venostasis ulcers, this is a further worsened complication of untreated vein disease that I truly hope to avoid in anyone who has symptomatic vein disease. There's a significant degree of swelling that occurs in those lower extremities due to the vein disease and the fact that those valves are not working. All that blood is again pooling down towards your lower extremities, feet and toes and ankles. As that swelling continues to worsen, it's almost like a water balloon filling with fluid, and it ultimately thins the skin significantly to the point where the skin can have weak spots and breaks. And that extra fluid that's hanging around under the skin tissues can start to weep through those skin breakdown areas. They can cause worsening discharge to sometimes develop, and this continuous fluid that's almost oozing out of the leg can develop large wounds, as seen here in these pictures, that we call venostasis ulcers. These can be located on the calf or ankle area. They're often very painful. I haven't known one to not be painful. And to get these to heal can sometimes be a long course for patients. There's again looking to treat an underlying cause of valve dysfunction, if possible, as well as tight compression on the legs to help remove the swelling from the legs, so its path of least resistance is not to simply continue to drain out that ulcer. And medicated bandages are often required to help give that squeeze and compression and keep these ulcers from obtaining serious skin infections. Those dressings typically need to be changed on a regular basis, oftentimes at either a vascular surgeon's office or a wound care center. So how do we know if someone has this underlying cause of valve dysfunction in their veins? Well, testing for vein disease is pretty simple. It's completed with an ultrasound that's looking for that venous reflux. We can actually see the blood flowing in the wrong direction inside these veins. This is a non-invasive test, like any other ultrasound would be. Again, we're looking at the direction of flow in these veins. This is a very important test to determine what treatment option is indicated for each patient's condition and needs. There are surgical and non-surgical treatment options depending upon what is identified on a venous ultrasound. Non-surgical treatment options of vein disease include compression stockings, elevation, and exercise. An important thing with compression stockings is that these need to be prescribed by a physician. This is because not everyone just simply has vein disease. Some of us have multiple illnesses going on at the same time. What's critical is to have a vascular surgeon check your artery blood flow prior to putting on compression stockings. Again, the arteries are the blood vessels that carry blood to your legs, and the veins bring it back to your heart. If someone does not have appropriate and sufficient artery blood flow to get down to their toes, and too tight of compression stockings are applied, you can actually induce wounds to start developing, which is not ideal. There are different strengths of compression stockings that are prescribed to you based on the extent of your disease present. As you can see in my picture, I wear compression stockings myself. They can be very stylish and multicolored. They can be simple, plain blacks and nude colors. But the important part is to make sure that you're wearing something that's comfortable and sized to you appropriately when it's prescribed by a physician. Now, while I don't have vein disease myself, at least that I know of, I haven't seen varicose veins or spider varicose veins. However, wearing compression stockings alone helps me on especially my long working days to make sure that my lower extremities feel better. If I don't wear my compression stocks and I have a long day at the office or in the operating room, I truly have significant swelling in my legs to where it's just uncomfortable. And all I really want to do is put my legs up and kind of hang out on the couch and let my legs feel better before I do anything else when I get home, just like that picture I showed of that lady rubbing her legs. So I do feel that there is a significant benefit in compression socks when they're indicated. Now, exercise is also very important. As I discussed a bit earlier, your calf muscle is an important part of your circulation. As you are even walking and climbing stairs, even easy activity that's still considered exercise, your calf muscle is squeezing against your veins. Imagine it almost milking those veins and helping to push the blood up towards your heart. And hopefully your valves are intact. If not, this is still an important part, however, to improve your overall circulation, and it is an important part in decreasing the amount of swelling in your legs. Elevation is a little bit more obvious as this also decreases swelling in your legs, but getting your legs elevated, especially if you can above the level of your heart, has gravity helping you in your favor. Instead of gravity pulling down towards your toes, gravity is now helping to move that blood up towards your hips and out of your legs, which decreases your swelling significantly. Now, surgical treatments of vein disease, as I mentioned, have definitely advanced over time. You may have heard of someone or known of someone who had a vein stripping historically or say several years ago. This was a procedure that was mostly reserved for very severe cases of vein disease. It was much more invasive, where the veins were physically removed from the legs that were causing problems, and oftentimes had to be done with more significant anesthesia or general anesthesia. At this point, technology has advanced significantly, and we offer a minimally invasive approach to these vein treatments called endovenous laser treatment. This is a procedure I'll describe further in a second, but in short, it burns the inside of the vein closed, and this will ultimately scar completely shut to eliminate the venous reflux present on your ultrasound. And therefore, this eliminates your leg symptoms and your bulging varicose veins. For varicose veins that are larger, as shown in those pictures, and are causing significant complaints and problems, pain and tenderness, and sometimes bleeding, there is an option at the time of a laser treatment to remove these varicose veins through very tiny incisions that we call a microphlebectomy. These incisions are so small that no stitches are required. The nice benefit of these treatments, especially when paired together, is that they can be completed under local anesthesia only. So what is an endovenous laser treatment? Well, if you follow along with me on the timeline diagram here, it gives you a nice idea about what would be involved in case you are noticing these symptoms or skin changes in yourself. As you come to see someone like myself or my partners at Columbia Surgical Associates at our vein center, we have an initial consultation and ultrasound if it's not already completed to see if you have venous reflux and those non-functioning valves. Typically, if people have not been wearing compression stockings, this is a requirement by most insurance companies to give a good effort at the compression stocking use for 3 months. Then at the follow-up, we can see how you are progressing. If there is still lack of control of your symptoms and your disease process, and a surgical procedure is required, it is submitted for your insurance at that time. The procedure itself, including the microphlebectomy and the laser, is all completed at one visit. So the procedure for an EVLT, that endovenous laser treatment, again, a minimally invasive procedure, is performed with a high-energy laser fiber directly administering heat into the affected refluxing veins. We use ultrasound imaging in order to help us guide that laser fiber to a precise location in specific veins that are refluxing. This is used as well afterwards, as you can see on the timeline, for two important follow-ups. And what this laser is going to do, besides the heat of it burn the inside of the vein, is clot the blood that's in that vein. Now remember, these veins that we're talking about are considered superficial veins. That means they are closer to the skin surface. They're a little bit deeper than those varicose veins you may see, but they're not deep, say, down by your bones where a deep vein is located. So there is low risk of having a DVT develop. We take special precautions to prevent this from happening during the procedure. However, since there is a very slight risk of this developing, we ensure that we check this at your follow-up ultrasounds. Additionally, on those follow-up ultrasounds, we ensure that there is no blood flow in the vein that was treated with the laser. Unlike a traditional vein stripping, which is again that kind of more aggressive removal of those affected veins, an EVLT procedure requires no incisions, no stitches, and no general anesthesia. Patients go home the same day after the procedure, and this procedure results in significantly less discomfort and downtime compared to the traditional vein stripping. However, you get the same positive results, not just cosmetically, but functionally and symptomatically. So again, the kind of difference in EVLT compared to more traditional procedures, as a wrap-up here, is that your treatment is very short. It can take about an hour or less to complete the laser portion and, if needed, the microphlebectomy. Again, it's an outpatient surgery performed in a doctor's office type setting or an outpatient surgical center. This is typically covered by insurance, including Medicare, and it delivers a fast relief of symptoms. In that first follow-up, as on the timeline, which occurs just a few days after your procedure, I have patients return very grateful, as I mentioned in the beginning of the slideshow here. They're very grateful that they already have relief of their symptoms. They tell me that the pressure and heaviness and achiness in their legs is already significantly better in just those first few days. So this gives patients a very potentially faster return to normal activity compared to the classic surgery. I have most patients go back to work that day after their first follow-up visit. So I'd like to review the diagram briefly here to the left of the screen, as I think this is exceptional to show, as I mentioned before, how this procedure works for the laser treatment. You can see how at the lower part of the screen, there is a small catheter that is imaged directed into the vein. So when we use ultrasound guidance, we follow from what's shown at the top, the saphenofemoral junction, down the greater saphenous vein, where we then insert the laser fiber into the vein after applying local anesthesia. That laser fiber, as you can see in the picture, had started very near that junction. And as it is brought out very slowly and that heat's delivered, there are already changes, as demonstrated in this cartoon here, of changes in that vein where it is scarred shut and there is blood clot in there with no significant blood flow. That laser is simply pulled out through the end of that vein and pressure is held to ensure there's no bleeding. And that is the short, quick procedure of a laser treatment. So vein disease, in summary, as you can see, has quite a variety of symptoms for patients. It can have some serious complications if left untreated. Most patients are extremely pleased with their outcomes and that their symptoms are significantly improved, if not resolved, within just a few days. It's a minimally invasive treatment option that we have available for you. At Columbia Surgical Associates, my partners and I see, evaluate, and treat vein disease on a regular and daily basis. We develop a treatment plan tailored to each patient's individual needs, as I described through the presentation. So what's your next step? If you've recognized vein disease in your legs or someone you know, or have symptoms as I described in this presentation, know that you don't have to continue this way. You can make an appointment with Columbia Surgical Associates today to begin your evaluation and your road to recovery. You can see our Columbia Surgical Associates Surgical Center website for additional information if needed and to make an appointment today. That website address will be available in just a moment. I'll take any questions now if there are any from any of our attendees, and just want to thank you for joining. I hope that I've been able to express some information of vein disease and answer any questions people may have. I know this is truly a wonderful procedure and I thoroughly enjoy it. I'm very proud of our team at Columbia Surgical Associates Surgical Center, where I feel we have very well experienced people helping me and helping you to treat your vein disease. I thank you for joining us this evening. And again, remember, at Columbia Surgical Associates, we can see, treat, and evaluate your vein disease as we do for many people on a regular basis, developing your treatment plan tailored to your individual needs. Here's our vein center phone number and our surgical center email address that you can find any information that you didn't receive here today and make an appointment if you feel that you can benefit from treatment of vein disease.